Total cases, 8,551 new cases reported, 3,339 people in the hospital, and sadly, 6,729 who have died. Our prayers are with those who've lost loved ones this year and who are fighting this cruel disease. Although overall testing was down as expected during the Christmas holidays, we saw the highest number of people in the hospital and record high percent positives. Keeping people from getting sick and having to check into hospitals, that's an urgent priority. Right now, I'm asking every North Carolinian to double down on our prevention efforts and protect each other by wearing a mask, being responsible, following the protocols, and making good decisions. The latest recommendations from the White House Coronavirus Task Force offer stark warnings for those over 65 years old or with an underlying health condition. The task force cautions that these people should not enter any indoor space where people aren't wearing masks and recommends having groceries and medicines delivered to avoid exposure. That's a lot. The recommendation stresses that gatherings of people not wearing masks, public or private, simply are not safe. That's how prevalent this virus is right now. We must take these recommendations from the White House and all safety precautions seriously. As our fatality numbers show starkly, this is a matter of life or death. As this pandemic continues to take lives and livelihoods, many people are struggling to make ends meet. Financial challenges are difficult at any time, but especially during the holidays. In an effort to ease some of that burden, I have signed an executive order to extend the state's eviction moratorium through January 31st of 2021. Too many families are living on the edge, trying to do the right thing, but left with impossible choices. This order will help them stay in their homes, which is essential to slowing the spread of the virus. Earlier this year, my administration created the HOPE program to help both renters struggling to make ends meet and landlords who depend on income. This program provides payments directly to landlords and utility companies, and over 21,000 renters so far have been notified that they're going to receive help amounting to $37.4 million. The overwhelming need for this assistance versus the money that we had meant the program had to stop taking applications. But fortunately, help from Washington is finally on the way, and we look forward to opening it back up. Over the weekend, the President signed legislation that provides funding for vaccine distribution, schools, direct payments to individuals, help for small businesses and hospitals. It includes a badly needed extension of federal unemployment assistance and direct payments to families that qualify. The federal package also includes funding specifically for rental assistance, and we expect North Carolina to receive about $700 million for that purpose. When North Carolina receives these resources, I plan to work with the General Assembly to help disperse it quickly and effectively. As we move ahead with getting this support to those who need it, we must not lose sight of our primary goal, preventing the spread of COVID-19 so we can save lives and revitalize our economy. We have to protect ourselves and each other every day, every week, every month. The vaccines offer hope, but this hope will take time to fulfill. We continue to distribute the vaccines across the state as quickly as we get them. We remain in the first phase, 1A, vaccinating frontline healthcare workers and staff and residents of our nursing home programs and long-term care settings. Our hospitals and local health departments are working hard to get vaccine to people. There's a lot we have to do, including following the state's rules on the order of priority. There's a lot they have to do that, to follow those rules. Secretary Cohen and I have asked leaders from the state's clinical boards and associations to provide us with recommendations on the best way to enforce those vaccine priority rules. Now I'm going to ask Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, to share an update on our data and on our vaccine efforts. Dr. Cohen.
Thank you, Governor. This will be our last press briefing of 2020, and it's hard to believe that we've held more than 110 pandemic briefings this year. You've all heard me say the 3 W's a lot. And as I reflect on this past year, look, it's been incredibly challenging, but I'm also so proud of our state. All across North Carolina, people have been coming together to protect one another and to save lives. And while there's still so much to do, we head into 2021 with a powerful tool to stop this pandemic: vaccines. Today, I'm going to walk through the new phases of North Carolina's vaccine plan. Based on new federal recommendations that were just issued last week by the CDC Prevention's Advisory Committee on Immunization Practices, or ACIP, we have updated and simplified the state's vaccination prioritization plan. First, I just want to share some important information about vaccines in general. We have been very fortunate that scientists had a head start. The vaccines that are now available were built upon years of work in developing vaccines for similar viruses. All vaccines are rigorously tested for safety and effectiveness, and more than 70,000 people volunteered in clinical trials right here in North Carolina as well for the 2 vaccines now available to make sure they were safe and work to prevent COVID-19. To date, both vaccines that are currently available are 95% effective in preventing COVID-19. There were no serious safety concerns in the clinical trials with either vaccine. You could have temporary reactions like a sore arm or headache or feel tired and achy for a day or 2, but you cannot get COVID-19 from the vaccine. Vaccines will be available to everyone, but currently supplies are limited and will continue to be limited for the next few months. Therefore, states must make vaccines available in phases. You'll see as I go through the phases that everyone has a spot to take their shot. To save lives and slow the spread of COVID-19, the first phases focus on protecting healthcare workers caring for patients with COVID-19, protecting people who are at the highest risk of being hospitalized or dying, and protecting those at highest risk of exposure to COVID-19. So right now, we're currently in that first phase, phase 1A. Most of our hospitals received their first shipment of vaccine less than 2 weeks ago. Local health departments started receiving vaccine dosage just last week, a few days just before Christmas. Together, they are vaccinating healthcare workers caring for and working directly with patients with COVID-19, as well as those giving vaccines. The early data suggests that there is still work to be done to be sure that vaccines are administered equitably. Understandably, communities who have faced long-standing and continuing racial and ethnic injustice in our healthcare system may feel greater distrust towards vaccines. We are partnering with trusted community leaders and organizations to provide accurate information to all North Carolinians, and also with our vaccine providers to ensure equitable access to vaccines. Long-term care residents and staff are also being vaccinated right now. The federal government is overseeing that long-term care vaccination through a partnership with Walgreens and CVS. This effort began on Monday, and data is not yet included in our vaccine dashboard. We anticipate moving to the next phase, phase 1B, in early January. Currently, there is not enough vaccine for everyone in phase 1B to be vaccinated at the same time. To best manage vaccine availability, we will open phase 1B in groups. We will add additional groups from phase 1B over the month of January, one at a time. Vaccines will first open to Group 1, which is anyone 75 years or older, regardless of medical condition or living situation. In Group 2, it's our healthcare workers and frontline essential workers who are 50 years or older. They'll be added in next. This group will be followed by Group 3, which are healthcare and other frontline workers of any age. Just like the the previous phase, the groups in phase 2 will begin one at a time. Vaccines in phase 2 will open first to anyone ages 65 through 74, regardless of medical condition or living situation. Next, will come to anyone 16 to 64 with a medical condition that increases the risk of severe disease from COVID. They'll be followed by anyone who's incarcerated or in a group setting that has not already been vaccinated because they're a part of an earlier phase or group due to their age, medical condition, or job function. Then vaccines will open to other essential workers as defined by the CDC who have not yet been vaccinated. In phase 3, college, university, and high school students 16 or older will be vaccinated. Younger children will be vaccinated when the vaccine is approved for them. It is not currently. And in phase 4, that's when anyone else who wants a COVID-19 vaccine can get one. But remember, with the limited supply of vaccine, we think this could be well into the spring. Okay, that was a lot to cover. All of these details are now outlined on our new vaccine webpage, yourspot.nc.gov. Your shot, your spot, yourspot.nc.gov. As we head into 2021, the vaccine is a powerful tool, but we also head into the new year in a very dangerous position. We are setting records for the percent of tests that are positive. We've been at 14% for the past several days. Hospitalizations are alarming, with record numbers in the hospital and record numbers in the intensive care unit. I'm very, very worried and talking regularly with our hospital leaders. The spread is so critical that the White House Coronavirus Task Force has issued stark warnings to North Carolina this week. If you are under the age of 40 and you gathered beyond your immediate household, you need to assume you became infected with COVID even if you don't have any symptoms. The task force warns that if you are dangerous to others and must isolate away from anyone at increased risk for severe disease and get yourself tested. As the governor mentioned, the White House Task Force report also says that if you are over 65 or you have significant health conditions, you should not enter any indoor public spaces where anyone is unmasked, and you should have your groceries and medications delivered. We all have a responsibility. Be sure you are always wearing a mask. If you are with someone that you do not live with, you need to wear a mask over your mouth and your nose. Wait 6 feet apart and avoid gathering with people outside of your household. If you must, keep it small, keep it outside, and always wear a mask. Wash your hands often throughout the day. Wear, wait, and wash are 3 W's. And whatever your reason, get behind the mask. Thank you, Governor.
Thank you, Dr. Cohen. Using the guidance from independent federal and state advisory committees, North Carolina continues to work to get this vaccine to people as quickly as possible. The vaccine, along with more funding from the federal government, have provided a glimmer of hope at the end of a long year. When we rang in 2020, we didn't expect to be closing it out in the grips of a global pandemic, but here we are. And we have to seize our resolve and make it last. We've learned a great deal about how to combat COVID-19 since this virus emerged. But we've also learned a lot about our communities and ourselves. Let's live up to our ideals by doing what we know works. Wear a mask, practice social distancing, avoid gatherings where the virus can be spread easily. And remember, this New Year's Eve, we still have a modified stay-at-home order in place from 10 p.m. to 5 a.m. Our collective New Year's resolution should be keeping each other safe in 2021. Most North Carolinians worked hard to care for one another in 2020. Let's continue those efforts and keep that spirit going as we turn the page on a new year and prepare to turn the corner on this pandemic. Also with me today is our Secretary of Public Safety, Eric Hooks, Department of Emergency Management Chief of Staff Will Ray, and Pryor Gibson, Assistant Secretary of Commerce for the Division of Employment Security. Monica McGee and David Payne are our sign language